Great. So we're nearing sort of 50-ish participants. I'm going to start introducing the panel and the speakers we have for today. We're really pleased to have 3 people join us for the panel today. So we have Dr. Andrea Winkler, who is could we probably just have the first slide of the sharing up, if that's okay. So she's Professor of Global Health, and her affiliations are the Technical University of Munich and the University of Oslo. Importantly, she's the co-chair of the Lancet One Health Commission. We also have speaking today Associate Professor Dr. Phan Ki Hu, who is an Associate Professor and Neurologist at the University of Putra, Malaysia. So he'll be doing the second part of the talk. And then on the panel, we also are very glad to have John Amosi, who's the other co-chair of the Lancet Healthcare Commission, and he is his affiliation is of Kwame Nkrumah University of Science and Technology, and he's the head of the Department of Global Health there, and also a physician, of course. So I think we're about 2 minutes past, about 3 minutes past actually. So I'd like to hand over now to Dr. Andrea Winkler for the first part of our talk. Thank you.
Well, thank you very much sorry, I'm maneuvering the slides myself, right? Yeah. So thank you very much, Viraj, for this kind introduction. And again, I'm really pleased to have Professor Dr. Phan Ki Hu from Malaysia with us, and also Dr. John Amosi from Kumasi, Ghana, later on during the panel. So again, happy Brain Health Day, World Brain Health Day to all of us today. And we are celebrating this day with, I would say, a quite unusual concept, but rather innovative concept of One Health and neurological disorders, an interdisciplinary multi-health approach. So before we are moving to our speaker, Phan Ki, I really would like to introduce briefly for the next 6 to 7 minutes or so the One Health concept to you. So basically, the One Health concept looks at human, animal, and environmental health together at their interfaces, but also within the socio-ecological system that all 3 of them are taking place. It's a very holistic approach. It's an interdisciplinary approach, a multi-sectoral approach, and a very equitable approach. It's an old concept. And we have known for ages through religions and traditional concept that we are all interconnected, animals, humans, and the environment. And you can see in the picture, this is actually what it should be. And this is what it has become. Our world is suffering from a serious disconnect for quite some time at the expense or at the progress that we are experiencing. Of course, a staggered progress, not happening at the same speed around the world, is at the expense of this connection. So we are disconnected today. That's just to set the scene. I think we can all agree on this, and what's happening, like climate change and biodiversity loss, urbanization, you name it, it's really a part of that disconnect. So why is it so important to have a One Health approach? So there are various different definitions. So for example, the Lancet One Health Commission, at some stage, we defined One Health as an integrated, so integration is really important, approach to advancing multi-species health at the human-animal environment interface. Since then, we have moved from that interface. The interface still is very important, but we are now more or less considering the socio-ecological system with all the different determinants, the social, the economic, the political, etc., the trade determinants, and we place health of humans, animals, and the environment right within their socio-ecological system. It's very abstract, but we try to make it concrete later on. And there's another definition where a very valued colleague of ours, Jakob Sinstag, who is really a One Health person through and through, he and his group are defining One Health as an added value in terms of human and animal health, financial savings, but also environmental services, etc. Compared, so basically the cooperation has of those two sectors, which is human and animal health, has much more of a value than compared with the two medicines working separately. But that is very human and animal centered. By the way, One Health has emerged, or the One Health concept that we talk about these days has really emerged from veterinary sciences. And that was like 150 to 200 years ago, but it's really inherent in old and traditional concepts, religious concepts, etc. This is the latest definition from the One Health high-level expert panel that is advising the quadripartite, which is WHO, WOAH, the new World Animal Organization, or the new name of the previous OIE. It's UNEP, the United Nations Environment Program, and it's FAO, the Food and Agriculture Organization of the United Nations. So they are, this One Health high-level panel are advising that quadripartite in terms of One Health, the concept, but also how to implement. And they have actually singled out collaboration, capacity building, coordination, communication across disciplines, across sectors, and within societies at large, at local, national, regional, and global level, and also within urban and rural areas. Not forgetting the mobile communities. So we had the Lancet One Health Commission. The Lancet One Health Commission has been launched in 2019, so just before the pandemic, which I'm sure you can imagine was quite a bit of a upheaval, because that changed are the evidence synthesis of the value of One Health. We have a big case study on food systems, but we also have smaller case studies. We have defined with 30+ commissioners One Health principles for implementation, and we will also give recommendations for One Health operationalization. We are working on the report. We are within, I would say, the final round, and hope to submit it anytime soon in autumn, but definitely this year. And what you see at the bottom is the pre-launch, and on the right side you can see our figure. I'm not going into that figure, but it just demonstrates the interconnectedness of different parts of different disciplines, but also sectors when it comes to the definition of health, and also to jointly define outcomes and reachable goals. This is the commission. So John and I are chairing, and then we have an array of knowledgeable colleagues around the globe. We have taken good care of equity, both in terms of gender, but also ethnicity, etc. And this is what we have come up with. We have 3 secretariats. So one is, of course, in Kumasi with John, one is in Oslo, and one is in Munich. So I'm just setting you up for a couple of more minutes before I hand over to Funky Ho, who is going to introduce you to a really good neurological One Health case study, which is rabies. What we have been working on is actually the pork tapeworm. So we are, most of us, most likely most of us have a neuroscience angle, or even neurologists today on this webinar. So neurocysticercosis, the cysts of the pork tapeworm, are most likely well known to you, and that's you have just seen the life cycle. I can quickly go back. It's between the pig and humans. Humans are definite hosts, they harbor the adult worm, and pigs have the cysts, the larvae, and then of course pork is eaten by people. It's not well cooked oftentimes, and then larvae hatch, etc. So, and then pigs get infected by eggs from the adult tapeworm that is excreted by humans. And I'm just going through it quickly here. This is the real One Health case study, because we have to work with parasitologists, we have to work with lab people, with immunologists, clinicians, radiologists, veterinarians, public health experts, diagnostic experts, so One Health diagnostics in terms of point of care test is very important. Knowledge sharing and education, and of course communication, and not the least digital communication. This is just concerning rabies, and what you can see, this is just to set you up for Funky's presentation. Basically, this shows you the investment into rabies in different sectors. And what you can see here is, of course, the regions, Africa, Asia, South America. And the highlight is in South America, where quite some funds have gone to dog vaccinations, more than in the other regions. And you can see that the outcome is actually when you go to the human sector, so the human rabies death are the least in South America, where the investment is actually in another sector, the animal sector. But Funky will dwell more on this for sure. We have talked a lot about infections, but it is also with the NCDs that are One Health approach, and we have cardiovascular diseases and dementia, headache, etc. Well ingrained within neurology. And here again, a One Health approach is definitely beneficial when it comes to nutrition, physical exercise, but also how we relate to animals as companions, etc. I leave the NCD part. We can discuss it later on. I don't want to close the introductory words without really mentioning a big achievement by the Brain Health Unit at the WHO, the Department of Mental Health and Substance Abuse, called the Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders. It has just recently been endorsed by the World Health Assembly. The guiding principles are highly innovative. They look at a life course approach and intersectoral action, empowerment of people, but also gender equity, human rights. And all of that is actually part of the One Health concept. And I just copied, and I'm very proud to say that the core group that has developed that plan under the Tatarundua and her team have for the first time incorporated One Health narrative into an action plan that is quite dominated by NCDs, because of course the burden of neurological diseases are NCD dominated. I'm not going to read it out to you. I have highlighted important words for you just to pick up, because I just need to rush you through this in the interest of time. I also like the new term of brain health equity, where we really look at equity in terms of access to brain health care. And that is really different when it comes to the socioeconomic status, but also when it comes to the neurology workforce. Something that needs to be borne in mind when we talk about equitable approaches for neurological disorders. Please don't forget that any One Health approach is also impinging and impacting heavily on economics. We have been discussing degrowth to really preserve biodiversity, counteract climate change. So we need good economics that change the inequities that we are facing at a small scale, but also at a very large scale. And last but not least, One Health is always a political undertaking. And that term One Health has been removed more or less from the zoonosis term, where it started off from, to a political term through the pandemic, of course. It's now center stage. And what it really means is collaboration, communication, cooperation at different levels and including different sectors. And that, of course, the pandemic has sparked all of this. And without further ado, I'm slightly over time. Funky, please also take a couple of extra minutes. I would like to hand over to Funky, who is now going to present a very concrete neurological One Health case. Thank you very much.
Thank you, Prof. Andrea, for the very kind introduction. So basically, I would like to share the rabies experience and local experience in Malaysia. So I'm very grateful to in this clinical exchange platform to share with everyone. So basically, I will start with a case about 2 years ago, which is presented in Malaysia, which is at the East Malaysia, 53 years old lady. So had the history of dog bite over the left hand 2 months ago. So what we'd like to highlight, there's a poor awareness among the Malaysia, is this patient is not attended any healthcare for the treatment after the dog bite. There's no poor wound washing, there's no vaccinations, and there's no hemoglobin was given after the dog bite. So 2 months later, she presented to the hospital with aggressive behavior, very classic neurological presentation, hydrophobia in the rabies case. Then she was rapidly progressed to confusion and loss of consciousness. And the MI was normal. And time to onset to days is about 11 days. So this is a summary of cases just recently, the outbreak in Malaysia, in the East Malaysia from 2020 and 2021, which is in one of the hospitals. So it's a case series that try to collect the history of the rabies patients. So I would like to highlight that from all the 6 cases in this hospital that they published in the journal that have been shown that the education level, so it highlights there's the importance of the public awareness that the patient need to be promptly go for wound washing, and a vaccination should be given, as well as the rabies immunoglobulin should be given is indicated. And what we can see, the time onset for the cases that patient from rabies, which is earlier, that the earliest is about 70 days until one patient is presented after 2 years. And this is a definite rabies case confirmed by the serologist. So the youngest patient is about 4 years old. The oldest patient is 60 years old. So it's covered a wide various age group of the patients. So all the patients have the phenotype of not only furious and paralytic. Some patients be presented both phenotype. And the time onset to the death, the earliest about 3 days. So some patient lasted about 19 days in the ICU. So MRI finding give may not be a very specific. Some patient may have some finding in the basal ganglia telomeres. Some patient may have some medulla changes. Some patient the MRI were totally normal. So most of the cases are definitely rabies, and only 1 cases are probable rabies, which is the PCR are not available. So I would like to share the history that what really happened through the rabies outbreak in Malaysia. Actually, the first cases rabies in Malaysia was 1924, which is started from the West Malaysia. I will share you the map of Malaysia, then we can know a bit detail in the geographically in Malaysia, how the movement of the rabies case among the Thailand border and Malaysia. So actually the first cases was started in Malaysia and Thailand border. Then subsequently the outbreak, another outbreak was in again the Thailand border. So ever since from there, the Malaysia National Rabies Control Program was started, where it started to notification is very important, and the vaccination of the dog, and it was started at the Thailand and Malaysia border. Then ever since that, we have a very good control for many years then. But however, another outbreak, which is from 2015, not only again from the Thailand-Malaysia border and Sarawak, which is the East Malaysia. So this is the Malaysia map in the Southeast Asia. So what is the rabies prevalent cases? Actually, is the Thailand and Malaysia border. So we have hypothetically thinking that probably the dog movement around the border and the Malaysia that started the spread of the rabies from the Thailand border to the Malaysia. And recently another outbreak, which is from the Indonesia, Kalimantan, which is from the East Malaysia, which is spread from the middle of the Kalimantan to Sarawak state. So this is the border in the detail, another map. So we started this immune belt region. So the notification since 1953, so we're able to control the rabies in Malaysia. So ever since that, 1995, actually the cases was less after started a very aggressive immune belt. Then 1999 to 2015, actually no cases from rabies until 17, then the outbreak come back again, which is very prevalent from the East Malaysia. So we have not many cases from 1996 to 1998. So from the outbreak of 2015 and 2018, again, the outbreak of 16 human cases, 15 deaths, and 1 patient survived. However, patients suffer from a severe neurological deficits. And which is the total of the outbreak from 2017 until now from the Sarawak, which is spread, the rabies cases should be confirmed by PCR from the dog. The cases which is confirmed, the variant is from Indonesia's rabies variant, and with the spread to the human cases of 35 confirmed rabies cases, and 33 deaths has been reported in this outbreak. So again, 2015, which is I shared with you, which is from the Thailand and Malaysia border. So the cases majority, and another the outbreak, which is recently more than 30 cases until now, which is spread, which is from the Kalimantan, actually from Malaysia. So this is the outbreak. So again, this is a map. So we are thinking that probably the movement from the dog that carry rabies actually is from the Mongols and the palm oil plantation, which is crossing the border from Indonesia and to Malaysia, which is going to the palm oil plantations. So this is a canine case which is confirmed by rabies. So this is the cases that published by the Department of Veterinary. So they show that the total confirmative positive cases in the dog, which is having the rabies during the outbreak of 2017 and 2018. And they did the final genetic analysis, which confirmed this rabies actually is from Indonesia origin with the VRI 2017. So ever since that, the Malaysia government has started the dog bite surveillance, the outbreak, which is from the Sarawak state. So they have to notify to the district health officer within 12 hours. So the district health officer have to go to the veterinary office, then they will carry out the animal or the dog carry out the sample, then the fish is they confirm the rabies cases. Then after that, they will carry out the border as well to take the sample from the dog at the buffer zone. So the possible mode of the spread at this moment, which is the outbreak from 2017 Sarawak, which is a movement of the stray dog infected by rabies, they may cross along the highway which is connected in the Indonesia and Malaysia. So during the construction of the highway as well, it opened up more land area that the foreign worker that can just cross the border without any permit. And the movement of the pets dog, which is from the worker or from other town, may following their owners, and the pet brought along by the owner to other towns, especially during the long vacation, which is the Gawai festival, which is the plantation festival in the Sarawak state. So in Malaysia, actually, we adopted the One Health approach, which is highlighted we're able to reduce the rabies cases with the approach of the One Health approach. So we emphasize of the effective participation and collaboration between the multiple disciplines. So we successfully mass vaccinated about more than 2,000 dogs, which is more than 90% of the dogs across the state, which is in the Sarawak state. So the effective of early post-rabies management has saved about 2 rabies victims from death. So there are total of 32 immune health informants team was informed, which is able to keep the 978 village from the stray dogs. So this is shared in one of the conference, the poster in one of the Ministry of Health team. So what the Ministry of Health Malaysia did, they started this control measure, mandatory rabies notification. So they also continues the active surveillance, as well as they make sure compulsorily this dog licensing annually. And there's a mass surveillance program in the Sarawak state, as well as the movement control regulation is getting tightening. So this is a guideline Malaysia. It also comes with 2 versions, in the English version as well as the local language version, which is in Malay language. So this is an algorithm that once we have a suspicion of cases of rabies, so the Department of Veterinary will start according to the algorithm and try to notify and carry out the surveillance and vaccinate the own dog, then confirm the rabies from the dog as well according to the algorithm. So this is also the algorithm that carry out very thoroughly, try to control the rabies cases in the outbreak area. So this is some of the photo have been shared by the Department of Veterinary Service of Malaysia. So they started this animal disease investigation. So when they suspicious there's a canine rabies, so they try to get some sample from the dog. So this is their office during the outbreak, which is in the central capital, one of the capital in Malaysia, Putrajaya, if there's a canine rabies outbreak. So they carry out the test in the veterinary research institute to confirm the rabies suspicious case in the canine cases. So this is a map. They try to mapping and try to trace of the surveillance of the rabies cases. So they're having a regular meeting to make sure in terms of the before the surveillance, vaccination and movement control activities. And of course, the police department also help out by checking whether there's any dogs have been movement across the state. Then of course, the stray dog or the dog owner have to get the vaccination of the rabies in terms of control of the rabies. And catching out the stray dog or in the affected area or for euthanasia to try to reduce the rabies cases among the stray dogs. And of course, they're packing the sample, they confirm whether the canine cases of rabies. And this is a public awareness in the primary school. So it be carried out by the Ministry of Health as well as the Department of Veterinary. So we try to instill the knowledge among the younger generation, which is primary school. So as well as this is also the school attending the awareness campaign. So the Ministry of Health also putting some banner in the villages, try to highlight they have to go to the nearby healthcare center for wound washing as well as vaccination or rabies immunoglobulin if indicated. So they carry out the surveillance, looking at the dog and try to checking suspicious canine cases, taking the detail from the neighborhood or the villages around the area. So this is one of the posters that have been shared also in the Ministry of Health in the public area. And thank you very much for your attention. Those are the local experience from Malaysia. So I'd like to pass over the floor to Viraj.
Excellent. Thank you very much, Fanky. My word, that's a lot of work done in your local area for rabies. That's each of those projects sounds like a lot of work in itself, and you just rattled off a lot of them. Okay, so that's the two talks we have for today. I think we'll start the discussion bit with just a few polls, if that's okay. So to those that are participating in the audience, you should see on your screen ready to come up a sort of series of questions. Here's the first one now, just to get you guys a little bit involved, but also to hear your perspectives on. Firstly, have you ever heard about One Health as a concept before this talk? So if you answer those, and we'll start seeing results for each of the polls as they come up. There's a few questions for the polls just to hear from all of you all around the world. And then as we're doing that, there we are. So there's a 70-30 split. So it's certainly educating quite a few people today about One Health, which is great. Super. So the second question should be coming up. And as it is, if you guys can think of any questions to pitch to the panel, if you just put them in the chat, and Greta and I will pick those up and ask the panel's opinions on them. So how useful do you think One Health is? How useful do you think One Health is for neurological disease? Super. Yeah, I'd hope that's about the spread of answers. Good. Are there One Health initiatives in your country, wherever you are now, or wherever you work? I'd love to hear from you. I can see some people are putting in questions already on the chat. That's fantastic. Thank you, guys. Any more, please do pitch them across. Yeah, so quite a few people don't know. I think that's reasonable, but considering 30 people didn't hear about One Health before, it's kind of okay that, that many don't know what the One Health initiatives might be in their country. Okay. And if yes, so if you did answer yes, you know about One Health initiatives, which areas are they in? Yeah. So infectious disease, antimicrobial resistance, almost nothing on non-communicable disease, which maybe that should lead to some discussion. And then of course 40% don't know. Completely reasonable. Okay, so I think, if I'm not wrong, I think that might be the last of the poll questions. I'll ask Greta to pick any of the questions that have come through on the chat, or any questions that people have put on comments before, and maybe pitch them to the panel.
Yeah, so I'm Greta Wood. I'm a clinical academic in infectious diseases based in Liverpool. And yeah, thank you for those absolutely brilliant talks today. I've got a lot of questions of my own, but we've had some very good and interesting questions in the chat. I know we have John Amawasi joining us, co-chairing the One Health Commission. So he potentially, if this could first go to him, but I'd be interested to hear from the full panel. We have a question in the chat from Almudena Sanz Gutierrez. What are the main challenges when coordinating human and veterinary health institutions? What can be done to make the communications between them easier? Professor Amawasi.
No, thanks for having me. I think it's a great question, because what this means is there is a need for the two areas to be really working closely together. I think it's very unfortunate that we've ended up with a situation where we have these two separate institutions or organizations or governmental setups as they are. If we knew maybe years ago what we knew today, I'm pretty sure we would have set up ministries of One Health or ministries of health, which would go beyond just human health. Maybe a bit late for that. Well, never say never. Maybe we'll get to that point. But that notwithstanding, recognizing the fundamental interconnectedness of humans, animals, and the environment we share is really at the heart of being able to push to work together. In fact, it should come naturally, although this doesn't happen, that we work together, because if we want to be truly successful, and you've heard from the presentations, really want to be successful with human health, want to be really successful with animal health, we cannot do this without the other. So that's the first point. Now, in being able to work together, one has to be able to demonstrate what the added value, and this is the expression that we use, the added value of One Health approaches are. When you're able to put on the table very clearly why the Ministry of Health, Ministry of Agriculture, Veterinary Services Department, or whatever, need to be at the table together for a particular topic or for a particular area, it sort of galvanizes the action. Where the challenges normally has to do with the financing, because who's going to do the paying? From whose budget will the activity come? To whose credit does any success go? And who takes responsibility for failures? These are the questions which, when we are asked together, the veterinary services, the human health, and not to forget also the environmental part of things. And this is where the conservationists come in, because one may say, okay, we're conserving the environment, even if that environment does not necessarily include animals or animals of interest, if I put it that way. The conserving environment in itself has implications for both the human health and the animal health. We've been talking about parks and recreational areas and green spaces in cities. These have direct impact on human health, but they're not managed by the Ministry of Health, and they're not managed by the Veterinary Services Department. so they need to be at the table as well. So just recognizing this fundamental interconnectedness and the need, demonstrating the added value and having discussions around who pays, who takes the credit, who takes the responsibility, very critical.
That's some really interesting commentary. Thank you very much, particularly about the taking credit and taking responsibility. I think we can see in academia, those can be really challenging areas. And yeah, not forgetting the environment. Prof. Winkler, do you have anything to add about that before we ask a second question to the panel?
No, Greta, I mean, this is, thanks very much for asking, but John has really said it all. It's really about stepping out of our disciplinary, I usually call it comfort zone, and a communication or cooperation is only truly inter or even transdisciplinary. So if we involve the communities and other ways of knowing, we call it transdisciplinary. It's only really truly inter or transdisciplinary when it's just my own experience, when it starts to becoming really painful. And painful means that you need to be ready to accept, first of all, other methodological approaches, other knowledge, and you need to be ready to step out into that space and just to feel a little bit less comfortable. But every one of us, of course, with our knowledge and institution and whatever we represent, has got to add to a specific problem. And also what John has, of course, said is very important. I would just like to add one thing is civil society. John has mentioned the environment. So the environment sector is also a forgotten sector when we talk about One Health, but also civil society, pressure groups, patient associations, caregiver associations, coming back to neurological disorders now, need to be at the table. And if you allow me one last sentence, I think the Intersectoral Global Action Plan for Epilepsy and other neurological disorders has shown this tremendously well. In the making of that global action plan, the consultations have been amazing, and they have been truly One Health. If we want to use that concept now in sort of the political sense, that we really cooperate across disciplines. Thank you very much.
Thank you very much. I'd like to take it back now slightly more clinical. We have a question in the chat. I might put it first to Fanky Hu because it's related to your presentation, but would you comment on the one surviving rabies case, delayed post-rabies management or experimental treatment protocol? And that was a question from Mary.
Sorry, it's a problem. I can't get further history from the cases. I think that somehow I think the patient was went for early vaccination and immunoglobulin from the post early vaccination and immunoglobulin was given for the cases. That's how we prevent the death for the patients. This I could recall from the cases. Yeah. So we like to stress the importance of the as soon as possible the vaccination. If the patient indicated for the immunoglobulin, I mean the rabies immunoglobulin, the patient should be given and of course the wound washing should be doing very thoroughly according to the protocol.
Okay, excellent. And I mean, we've got people working in all sorts of diverse environments on this call, which is one of the great values of these sessions. So if anyone actually would like to comment in the chat about your experience managing rabies in your setting or the challenges you face, please do comment on the chat. It's interesting and valuable to hear about different experiences in different settings. So Viraj, would you like to ask a question to the panel?
Sure, yeah. So there's a question in the chat here from Rahul Arora, and he asks, are there updated guidelines on concomitant anti-rabies and anti-COVID vaccination? And the kind of follow-on question from that is, do you think the natural history of coronavirus infectious disease lends itself to the assessment by the One Health approach? And I think that might be a good way to kind of outline the One Health approach. But yeah, I would love to hear from the panel on that. Maybe John, if you want to comment first, I know that you might need to shoot off a little earlier.
Yes, Viraj, can you kindly just repeat briefly?
Sure. So I'll repeat the second part first, I think. So do you think that the natural history of the coronavirus infection leads itself to assessment by the One Health approach?
Well, let me put it this way. The simple answer would be yes. Now, the yes is because coronaviruses have historically been identified in animals, in bats, fruit bats, to be most precise. That this is coronavirus. This is a broad genus, but the specific, SARS-CoV-2 has not been identified in bats except very close variants which have been detected in bats. The argument is, we know that other animals, including cephalids, mustelids, other mammals, are all prone to COVID. Recently, there was a Nature publication of how a man got COVID from his cat, and this was proven by sequencing. So what this tells you is it would be very important to pursue understanding COVID and particularly getting it under control using a One Health approach. In fact, most pandemic-prone diseases would require One Health approaches, not necessarily because a natural host may be an animal or not, but because with widespread infection, you risk a pathogen jumping from humans to animals and back and forth again, and then becoming some mutant that one could never have thought of. So it makes perfect sense, even in the absence of a natural animal host, to pursue pandemic-prone pathogens or diseases using a One Health approach.
Fantastic, very thorough. Any other comments from the panel before we go on to the next question? Okie dokie. So I think the next question we have one here from Ephraim. This is quite a wide-ranging question, and I think one of the big problems of politics at the moment. But from Ephraim Akachukwu, who asks, how would you resolve the misconceptions people have about vaccination? Some people refuse vaccination, especially in developing countries. This is obviously a big challenge, and one that I'm guessing One Health has tried to address in many ways, but would love to hear your thoughts from the panel. If we go to maybe Andrea first this time.
Yes, that's the $1 million question. But no, I think it all really comes down to transparency and transparent information passing on also through mass media. So we really have a responsibility. And what I really loved in Funky Ho's presentation, it was a great presentation all around, but I loved the pictures at school. So one was at kindergarten and one was at school.
Yeah.
And it's always so nice to see those little ones, especially in your countries. They're very disciplined. And they were all together. And so it just sparked that picture again that you can't start early enough with knowledge sharing. Of course, it needs to be tailored, right? And this is also when we talk about One Health knowledge sharing or One Health education. There's no point early enough to start, and you can always do it. So there's no point where you stop knowledge sharing about One Health. So that I think can be transferred to health in general. Health now also through the pandemic, and before it was not so prominent, but it needs to be in the agendas also at kindergarten, at school, primary school, secondary school, of course, all tailored to the ages. And infectious diseases, context specific, but also NCDs. And especially, we talk about infections and One Health all the time, but let's talk about prevention. Prevention also of infectious outbreaks, but prevention of non-communicable diseases. And that can be, of course, included into curricula from early on into biology or any other social sciences curricula, and of course that varies heavily from country to country. But then it's also knowledge sharing when it comes, to family communication, to communications at work, and the press and the journalists have got a huge responsibility for transparent and open communication. And I think there were problems, especially during the pandemic, where communication was not that transparent, or where people think that not everything can be shared with the public, which in a way I personally think is a bit of a patronizing approach. But anyway, so it is about communication, and it's about equitable communication, open and transparent communication, but this is very difficult to realize. And I would like to hear, of course, Funky's and John's view, because that is so important.
Indeed. Maybe Funky next. Has vaccine hesitancy been a sort of problem in Malaysia, and how do you think it's best tackled, maybe with One Health approach or other approaches?
I think so far shouldn't be so much an issue in Malaysia, because our government make it kind of mandatory. So if we are not receive any COVID-19 vaccine, we are not allowed to go to shopping mall or so in a way that, I mean, most of the public have to take the vaccine with the app. So we have this QR code. So if you are not vaccinated, you are not allowed to enter any public area. So in the way that I'm not sure this is the right way.
Oh, so you've never heard of vaccine hesitancy in Malaysia? Fair enough. Good. Okay.
Yeah,
that's how you get around it. John, in Ghana or anywhere you've worked, vaccine hesitancy and how you think it's best approached?
Yeah, no, I really like Funky's response and the wide grin on his face. But it just tells you that when it comes to public health issues and pandemics and the like, really the role of legislation is so critical. I mean, this line between the individual rights and the public's interest, it's got to be dynamic. And I mean, I can only but salute countries like Malaysia and others who really took the bull by the horns and said, well, I mean, if you don't do this, you're not going nowhere. At a point, I mean, you've got to do what one has to do, or you pay the consequences for not doing so. That being said, yeah, we had issues with vaccine hesitancy in Ghana. I actually published a paper on that, which you can look up. But what I realized that vaccine hesitancy is very dynamic in itself. It's a function of perceived risk, which changes with the news or the information that was making the rounds globally. So when the Delta broke in the Indian subcontinent, people were queuing up for vaccines. When it went away, I mean, people were being begged to take vaccines. So it's really really dynamic. The other challenge with the vaccine hesitancy, I think, was the messaging around vaccines right from the outset of COVID. There was so much noise about the need for a vaccine and how the vaccine was going to fix everything. And once you get the vaccine, you're not going to get COVID and everything's going to be fine. Just get the vaccine. Then the vaccines came, low middle income countries were marginalized, a lot of noise, vaccine equity, blah, blah, blah. And eventually we got some of the vaccines. Now it turns out that vaccination is not foolproof, that you can get the COVID even though you're vaccinated, albeit a milder form, you're much less likely to die. So the whole messaging, which was shifting, and we can't blame anyone, it was evolving knowledge, is what has made the general public, kind of like, it's sort of, no, not such a big deal after all, especially now that perceived risk is very low. So I think it's got many sides to it, vaccine hesitancy. And if we really want to push COVID vaccination, it's two things. Either we go the Malaysia way, or we redevelop some kind of motivations, which are non-mandatory to have people take the vaccines. Otherwise, we're pretty much stuck.
Fantastic. Great answers from all the panel there. Thank you, guys. I think to take it back away from vaccine hesitancy and back to One Health, I think Dr. Winkler, maybe we should do a sort of 5-minute summary at this stage, unless anyone has any more questions. I think a summary at this stage before we close the session would be great.
Yeah, no, thank you, Viraj and Funky. Please do join me and add to the summary on now coming back really again to neurological disorders and One Health. So what we need to understand, and today at World Brain Health Day, is that the One Health concept has not really entered the neuroscience area, so to say. It is a concept that is pretty much defined by infectious diseases. And to be honest, if we hadn't had, and still are having, a pandemic, it would have never come to the forefront. So the pandemic has actually shown the usefulness of that concept, but the concept is also changing. It is changing from a very concrete human health and animal health, and vice versa, animal health and human health, zoonotic approach to really an economic, but also a political concept that is actually much broader. And the bottom line is collaboration across sectors and disciplines, communication across sectors and disciplines, equity, a systems approach, so talking about the socio-ecological system that health is happening in. And I mean, the summary, it's in a way what at least I tried to make clear in my introduction, and but then Funky followed with this very good example. One Health, at least it's not named One Health in the neurological field, is not there yet. And the first step was really made, the first public step, I shall say, was made by the Intersectoral Global Action Plan for Epilepsy and other neurological disorders, that some very brave people, and one very brave person is actually on the call today. It's Nicole. She's from the Brain Health Unit, Dr. Tarun Dua's team, who has been majorly responsible for putting in One Health into the Global Action Plan of neurological disorders. Of course, we have many infectious diseases, but most diseases within the neurological field are non-communicable disorders. And the bottom line is that, and we saw that in the poll very nicely, that wherever we have One Health happenings, but also One Health plans, One Health approaches and concepts, implementation. We haven't really talked about implementation a lot today. Set up, it is always in the field, or most times in the field of infectious diseases, epidemics, pandemics, but also antimicrobial resistance. And I think it would be a wish from my side that we use neurology and neurological disorders. They have the highest disease burden worldwide and the second highest mortality, that we use that not just in a theoretical and academic way, but really to implement strategies, to implement interventions. And I think what Funky has shown, of course, rabies is obvious, or parasitic diseases are obvious, but also cardiovascular disease is obvious, physical exercise, nutrition, how you relate to the environment, how active you are, etc. And it goes that far that in some places on our globe, we now have even One Health clinics where people come with animals, they present, they get their blood pressure taken and their blood glucose checked at the same time, because they have lost trust in the human side of the health system. And they even come with plants in some areas. There are plant clinics together with clinics for people and animals in, for example, Uganda and other parts of the world. So I think we just have to be open and very innovative in our thinking, how we can tackle disease and how we can tackle health and prevent disease in a more holistic way. Please, Funky, if you can just add and maybe become more concrete as you are living through real One Health problems on a daily basis, especially now with rabies.
Yeah, I totally echo with the opinion from Prof. Andrea. So particularly Malaysia is a tropical country, so there are a lot of disease we have to use the One Health approach. For example, in the Nipah virus outbreak in 1998, which is the spread of the virus from the bat, and again, One Health approach is very relevant. Again, and the dengue fever is very commonly actually it's the most prevalent infectious disease in Malaysia. There are so many diseases in Malaysia that we should apply the One Health approach in the way that we can, benefit the whole community in Malaysia. And I would like to highlight the One Health approach is not only applied just for the country, probably, in the regional, so we have to work closely for the rabies cases with the Thailand government as well in the Indonesian government. So with the multiple discipline, department so it's not easy. So the One Health approach is the only way that we can put everyone in the same umbrella, so we can benefit. It as a whole for all the patients. Not only for the region as well. So I think that's all I'd like to add.
Excellent. I saw Nicolene's hand went up just after Andrea had mentioned. Nicolene, would you like to comment?
Yes, absolutely. So I'd like to say thank you, a big thank you to Andrea and to John and Fan Ki for your presentations today. I was very, very happy when we decided to make this the topic of discussion today, as it's something that is close to my heart. And I just want to really, really emphasize the importance and the value of advocacy and public awareness. So when we were putting together the neurology action plan here at WHO, we had it open online for input from a variety of different stakeholders. And there was a very strong push to include One Health and really to emphasize the importance of One Health within the scope of neurological infections. And so I was very pleased to see today that 30% of the people on this call did not know about One Health before this call. And now we've educated even more people. And so I really want to emphasize how important raising public awareness is and advocacy to advancing the whole idea of One Health. Thank you.
Perfect. Thank you. I think that's a fantastic point to bring things to a close. I'd just like to finally thank the panel for their time and their comments and their expertise today. I'd also like to thank all of the participants for coming along, really getting involved and giving some great questions, and to the Global Health Network for helping with all the technical side of things. Thank you very much, everyone. Thanks.